But the one that breaks usually is in 70% of the time, the first sign and warning of the heart attack is when they are dead. They don't get to anywhere. It's amazing. And usually it's not the tight artery that causes the heart attack. It's the less tight blockage because the cap is thinner. The thicker the cap, the more calcified, the more leathery, the more protective are. So patient can go to age of 90 and has got all the arteries like a rock, really, you know, like a beaded area, and no heart attack. So at least in that way we have the chance to work them up and see what's going on. So I think that I don't have that much of more than this time. Try to do this. The best way to really treat or get rid of this problem is to prevent. In period of my practice, I can tell you for sure the number of heart attacks has gone down tremendously. The number of cardiac arrests has gone down tremendously. The number of nights that they have been calling me to go to the emergency room is history. I haven't been to the emergency room even when I was really actively busy that much as I used to go there. And people come, they go to irregular heartbeat in a way that the heart is not pumping effectively, so the brain doesn't get the oxygen and the patient passes out and we have to give the patient shock to put the heart rhythm back to normal. Doesn't happen anymore because we get them before that happens. You know, ambulance sometimes is able to give these people medication that reduces the clotting, like aspirin. Everybody says that I took some aspirin. It really works. They get to the emergency room. If it is within 6 hours, we can give them something called clot buster. It's an injection of medicine that goes specifically to this white clot or fibrin and dissolve it. Okay? Yeah, it dissolves it. We are using this the same thing for a stroke. If we get the patient fast enough before they bleed into the brain, we give it to them. But let's say 10, 15 years ago, if we did that, that was malpractice. How can you give somebody a medicine to dissolve the clot while you know is having a stroke? You know? All right. If we get them to a big hospital, that they have a center that they can go there, take a picture of the arteries, and go with the balloon and open it and put the stent like a mesh or a spring to keep it open, like a scaffold, to keep it open. It should be within 90 minutes. So they really have to work fast. Patients should be aware, call 911 and get there fast. All right. So this is the way, but the best way is don't gain weight, exercise, don't smoke, watch the diabetes, because we know diabetes is getting more frequent even among young people, and the reason is very simple. The more weight we have, the less our muscle is sensitive to the insulin. The poor pancreas is secreting insulin. Sugar is up, I had the ice cream, not one, you know, like a gallon of ice cream. People have 1 spoon of ice cream. We eat, you know, the bigger the better. So what will happen, insulin is rushing, but we don't drop the sugar as much. Why? Because the body is resistant to that. So exercise makes the body more sensitive to the insulin. Anyhow, if we can gradually get rid of all these risk factors, obesity, diabetes, high blood pressure, proper dieting, exercise, not to smoke, avoid the stress, take it easy, okay? When we get really angry, our blood pressure goes up, our heart rate goes up, our artery go in spasm. If you put your hand in warm water, you see your vein pops. Put it in ice cold water, you don't see any vein. That ice cold water is exactly like the telephone call 2 o'clock in the morning that your teenager called you, I'm in accident. You know? So we try to avoid that. And what else? If there's anything else that I can, answer in a simple way.
You said that an aspirin would help. Would Aleve and ibuprofen do the same?
No, no.
It has to be an aspirin.
Aspirin. The reason aspirin works because it blocks a certain enzyme that it's covering the platelet, that tiny, tiny cell which comes and create the clots. So they do not stick to each other. Aspirin makes the blood more slippery and reduces the clotting. So even if there is a little clot, that clot doesn't expand. And it works pretty fast. And the interesting part is that one aspirin, when it stops the platelet is gone for its life, unless new platelet comes.
So you suggest taking an aspirin every day?
Not for everybody.
Okay.
But if you have at least 2 risk factors, and you don't have any chance of bleeding or bleeding ulcer or other blood problem, yes. But I would, again, check it as they say on TV. These days, everybody's doctor. You can die with this medicine, but check it with your doctor. So check it with your doctor. All right?
Thank you. Thanks so much.
All right.
Thank you very much.
Any other?